Welcome to Periop Talk, where we discuss the important current surgical topics and education for you to take back to your OR. Together, we're making surgery safer, one podcast at a time.
Hi, everyone, and welcome to AORN's Periop Talk podcast. I'm excited to be here today talking about AORN Center of Excellence in Surgical Safety Award programs. Let me start by introducing myself. My name is Hannah Campbell. Many of you listening may know me already from other AORN programs, but I am the program manager for AORN Center of Excellence Award programs. So I'm excited to be here today talking about AORN's RSI Prevention Award program specifically. These programs, the Center of Excellence programs, also include smoke evacuation. It also includes enhanced recovery after surgery, which launches in October. But again, today's focus is RSI prevention. And I am joined by two incredible nurse leaders, Jill O'Connor, who is the nurse manager for AHN Saint Vincent Hospital Labor and Delivery and Mother-Baby Department, and also Tracey Young, Perioperative Clinical Nurse Specialist at the University of Pittsburgh Medical Center, or commonly known as UPMC. Jill and Tracey have played key roles in their facility's journey to earning the Center of Excellence RSI Prevention Award, and they're here to share how their team built a culture of safety, collaboration, and accountability around preventing retained surgical items. So thank you both for being here. We're so happy to have you two as experts who have completed every step of the program. Before we dive in, Jill and Tracey, I'd love to hear from you, just a little intro about your background, how you got into nursing, and why this was an important program for you. Jill, let's start with you.
Sure. Hi, Anna. Thanks for having me today. My name's Jill O'Connor. I worked in long-term care for approximately 8 years at another facility. I decided to try something new and moved into labor and delivery nursing here at AHN Saint Vincent back in 2014. Saint Vincent supported me in continuing my education. I was able to obtain a bachelor's degree and then went on to a master's of science in nursing, nursing leadership specifically, while working bedside at labor and delivery. In January of 2022, I moved into a leadership position over the labor and delivery and postpartum units.
Very cool. Very cool. It sounds like you've had a really great experience at AHN, and they've been very supportive of your journey into your leadership position. So that's lovely to hear. And Tracey, I'd love to hear more about your background and how you got involved with this program to get started with AHN.
Sure. Hi, I'm Dr. Tracey Young. I got started with nursing back in 1993. I started as an LPN. Actually, as a graduate, wasn't even licensed in OB, which was very unheard of. And I wanted to work labor and delivery, so I continued on as Jill did and got my bachelor's, master's, and recently doctorate, which is what led me to this program. So I have 20 years experience in periop, 3 years nursing professional development, and 10 years in OB and labor and delivery.
Wow. Well, congratulations, Dr.
Thank
Tracey.
you.
That's a huge accomplishment. And I know, we started by our conversation when you first started the program. I learned that this was part of your DNP project. And I know we're a little off script here, but I think that is a fantastic initiative that you helped to start at AHN. So can I ask you, what prompted your facility and Tracey, your involvement to prioritize RSI prevention and pursue the COE designation?
Sure. So I met with Jill and with their leadership, which was very welcoming and very supportive. We discussed some things. We did use the AORN gap analysis tool, which was very user-friendly. And we decided that this program was definitely for us.
That's fantastic. That's really cool. Jill, anything to add there?
So we got into this because at one point in time, we had a very stable seasoned staff. And then once the pandemic hit, staffing became very unstable. Many of our nurses left for travel assignments throughout the country. We were forced to rely on agency nurses and new grad nurses. Previously, we would only hire 1 or 2 new grads each year. And our situation left us hiring new grads as the majority of our staff. We were left in predicament where we had no one to train our new staff. We had then worked with an agency that brought in travel nurses with the sole purpose of training the new staff, which they were all great nurses, but they came from varying hospital systems across the U.S. and they often oriented based on policies they held at their home hospitals and not necessarily our policies here at AHN. We noticed the new staff had various information in their timeouts, different ways of counting, and just other varying workflows. And then we recognized there's a potential for error unless we streamlined our process to align with our policies.
Totally. That's really cool. I love hearing that. Well, I don't love hearing that, it's an issue, right? Y'all are all so busy. And so when nurses come from different areas of the country, different facilities, you're right. Like their policies and procedures vary, which is problematic, right? So not everybody's moving in the same direction, and that can cause errors or, just miscounts or whatever it is when it comes to RSI prevention. So I'm really glad to hear that this program served as a way to kind of streamline everybody's education and get everybody moving in the same direction.
Yeah. If I could just add, I thought it was a great opportunity too, with labor and delivery, the amount of cesarean sections that are done. It was great to align it with AORN guidelines, for surgical safety and patient safety.
Absolutely. Y'all clearly care about evidence-based research and making sure you're following what is the right thing to do. So Jill and Tracey, I know that y'all talked about your team having kind of this full buy-in from your leadership, your surgeons, your anesthesia. They were supportive of doing the right thing and starting this program. To be honest, that's not always the case for a lot of hospitals or facilities interested in enrolling in this program or adopting adjunct technology or even this program for education purposes. Do you mind sharing maybe some approaches or conversations or even messaging that may have helped you get that kind of support that may help other hospitals?
I think the difference was I went further than just sending out a memo about what we were doing. Like I personally approached every nurse, OB, anesthesiologist, and explained the Center of Excellence RSI Prevention program. I explained why it was important to the unit. I asked them to sign a form stating they were in support of our endeavors. No one was willing to look me in the eye and say they didn't think this was meaningful, important work. So I think the face-to-face contact was really important.
Yes. Again, I attribute a lot of it to Jill's leadership and her leadership support. I mean, very, very great culture there.
That's amazing. And good on you for being, kind of brave enough to go and have those conversations, because I think it can be intimidating, right, in some cultures to go and say, hey, this is an important initiative. So I think it's really cool that you had that strength and vulnerability to go and have those face-to-face conversations. And I think that is probably what made a huge difference, like you said, like going and saying this is important and not just sending out that memo. So thanks for sharing it. That's great advice. Okay, so once you had the green light to start the program, I'd love to hear about how you rolled it out, because y'all did some fun things to engage your surgical team.
Yes. So I am crazy obsessive with football. So I decided, yes. I decided I thought we would name it the COE kickoff party. So along with football, so we did a tailgate theme, and we had tailgate snacks along with our education day, some Gatorade, different chips, things like that, cupcakes, and just really made it fun. I explained the program to them, and Jill again helped with having the staff come in to where the education was being held. And we also had some adjunct therapy education that day too. And the staff was very receptive. It was fun.
That's great. I love the combination too of like making it fun, right? Like making it like something that's not going to be, oh gosh, another staff meeting. You made it kind of a party and rolling out, hey, this is an exciting new initiative. And what's great is you worked with your medical device people to bring in the technologies. They started saying, hey, like this is the new processes and protocols we'll be using, and devices. So that's really, really cool. You had mentioned the gap analysis tool of the program being helpful to you. How did you assess your existing RSI prevention practices before you implemented? Was that part of that, or any other processes you took?
That was part of that. And Jill, I'll let you take this question if you don't mind.
Yeah, sure. So we observed many cases in the OR. So we could see where there was potential for error due to the inconsistencies in the workflow. I also ran some data in Epic, our health records, to identify confirm there were no routine surgical instruments. Excuse me.
And in addition to that, in the beginning, I also did the day of education. I myself observed in the operating room, and I was educating the staff on the audit tool. And then I kept in contact also with the staff via email, and I would also make it a point to attend the attend the unit weekly at least.
Mm-hmm. That's fantastic. And for those listening that don't know what we're talking about in terms of the program's tools, no, it's fine. The compliance audit tool is a tool provided within the program that helps you track all of the evidence-based recommendations, just like simple yes or no questions on an Excel document. And it's a great tool, and I'm glad y'all found it useful in terms of tracking and seeing where there may be some gaps in your processes. So that's fantastic. So you had a baseline, right? A lot of people will say, adjunct technology, we don't need that, like we can count, we know what we're doing. And, the research says, and it's part of the guideline, that it is going to help you prevent retained surgical items. So that being said, since it's in the guideline, adjunct technology, as you know, is a requirement to earn the Center of Excellence RSI Prevention Award. What role did adjunct technology play in your implementation strategy? And I know y'all, it sounds like you didn't experience any pushback, but I'd love to hear about how y'all implemented adjunct technology.
So we had already been using adjunct technology for several years prior to working towards the Center of Excellence designation. So the staff had already accepted that it's an expectation to use the adjunct technology with every surgical case. So we didn't really receive any pushback regarding it. But I was here, and I do remember when we initially brought adjunct technology to the unit. And so I just remember the product representative came, and he did a great job of explaining the importance of the technology and how it can really protect not only us legally, as well as the patients.
That's fantastic. I love that they were able to provide that feedback because they know best, right?
Yeah, they were able to give very specific examples of why it was important, and it really resonated with everyone.
Absolutely. And, there's now research that says there's a financial benefit of implementing adjunct technology, obviously not just for the safety benefits of our patients and also to the staff who have to deal with, oh my gosh, that, God forbid that happens, the staff deal with a terrible aftermath of that, feeling a sense of guilt and what have you. So not only is technology great for those purposes, but the financial reasoning too, like avoiding litigations or being sued, what's the price of an RSI, right?
Absolutely. And during my research, the price was approximately $170,000 to $190,000 per incident per RSI, and that is according to the Joint Commission.
Wow.
And as you had stated too, personally, as a periop professional, 20 years ago, I had a patient that had experienced an RSI. I am very and have always been very, very astute with surgical counts, and very known for that in the operating room. I still to this day feel very guilty. They state that most RSIs, most surgical counts are incorrect, and it's because of human error and the multiple things that are going on in the surgical suite at one given time. However, I do really think back to approximately 20 years ago. If adjunct therapy had been available then, I really feel this would not have happened, and I wouldn't carry this guilt to this day. Thank goodness the patient was okay. But it just is very, very disturbing that this could happen.
Mm-hmm. Tracey, thank you for sharing that. And
absolutely,
to carry that sort of guilt for 20 years is so hard. And it's you're right. Hard. There's so much going on, and there's so many responsibilities put on our nurses. So, having adjunct technology is a peace of mind, right? It's like one less thing that you're having to be responsible for.
Absolutely.
So thank you for sharing that, because you're also not alone. And I think a lot of nurses and leaders in the perioperative field are scared to talk about that.
Correct. It is very difficult. Mm-hmm. It really is.
It is.
But safety and peace of mind, there's tools that AORN supports, and the guidelines state that it is for patient safety.
Absolutely. Absolutely. And to give you all, the teams working so hard to save lives every day, a peace of mind. Thank you for sharing that. That's
Absolutely.
incredible.
Thank you.
I really appreciate that. I know that's not easy. And it shows how dedicated you are as a nurse. And so just
Thank
thank
you.
you I hope I have you as my nurse one day, because I know you'll
Oh,
take good care of me.
thank you so much, Hannah.
Well, thank you. And I think that your vulnerability and your willingness to share helps with my next question. But I would like to know how you foster a culture of accountability and being open to communicate in the OR, because that's a scary thing, right? Like, especially if you're a new nurse, speaking up can be a little scary. So I'd love to hear what y'all do to help with that. Can you share any other tips for how you give people a voice in the OR?
I feel that giving them a voice in the OR also stems from leadership and transparency. The transparency, like I just shared, and holding the staff accountable, knowing that we're using the audits. And even if we're not using the audits, that the surgical counts do align with the policy and guidelines that are recommended by AORN.
Absolutely. And there's no reason to hide. We're all learning as humans, and that's part of the program, right? You've got, there's no set timeline, as y'all know. We know that everybody's goals and teams operate differently, and there's no, timeline, although it's recommended, right, that we audit for 3 months. So you have 3 months every week to improve practice. And that's all we care about, just improving your practice every day. So I think that's fantastic. Thanks for sharing. Well, I know that you've used the tools. So have y'all observed any measurable improvements in your safety and your compliance or team's communication since completing the program? Any memorable reactions or stories you can share?
Sure. Since implementation of the standardized workflow, we've oriented new staff, and I'm seeing our preceptors giving consistent direction and education to the orientees. I'm not seeing those variances that we once were. Something memorable that occurred during the implementation. I witnessed one of the nurses was working on her education at the nurses station, and she made a comment about something that she didn't know related to retained sponges that she had learned on the module. This prompted like a whole conversation among the nurses. Then I saw like more nurses logging in to the education so they could read about it too. So then they would have something to say. That was really the moment that I knew that they were learning from these modules. They weren't just clicking through them. And since I heard this organic conversation happening, I knew I had staff buy-in at that point.
Wow. I love to hear that. I love hearing that. And it's like, it gives them something. I don't know. For me, I always love continuing education, right? Like, even though this program doesn't provide continuing education is, I think for nurses, fun. Like, obviously they're some of the smartest people in the world, so they enjoy this. And I love hearing that they're, one, learning something from it, and two, able to use it to talk to one another, kind of creating like a culture of communication and dialogue, and hopefully creating like even friendships from being involved in this initiative together. Really, really cool. Well, you've earned the award, so how do y'all plan to keep momentum going?
Jill has already done that.
Yeah, we're doing pretty well with it. One of our charge nurses she was heavily involved in implementing the process. She did a lot of our audits, and she's actually using this as her clinical ladder project here. So she's continuing the audits to ensure everyone is still following the intended workflow. And knock on wood, we haven't had any near misses since receiving the Center of Excellence Award.
Yay! Wow! Wow! That gives me chills. That's amazing.
That is awesome. Yes.
Yeah, so great. Anything else, Tracey, on your end that you've seen? I know you're busy doing your studies, becoming a doctor, but
I just think it's great. The culture has really been wonderful there, and I am sure that they are eager to do some of the other Center of Excellence programs that AORN offers.
Oh yeah, there's a whole suite.
Yep, and I can help them if they need help.
Oh, we love it.
All right. Well, looking back, is there anything you wish you had known before starting this journey? Anything that you can share with folks who are considering this program?
One thing I just want to say is just do it. I mean, it's scary to get started, but once you take that first step and do it, the leadership from the hospital and obviously the support from AORN and from you, Hannah, has been so amazing. Just to know that every single step of the way that you're there, whether it's a glitch in the modules, whether it's the Excel sheets that we have to do, anything like that, it really, AORN has made it super easy to do. How can you not do it?
Thank you. That means a lot to hear. That's our goal. It's meant to be supportive and not, oh, another thing we have to do. It's meant to be something that supports you in your practice and just makes you even better nurse leaders than you already are. So I appreciate that. And I know I kind of jumped ahead looking back, and I appreciate that advice for hospitals. Just go for it. We'll help you along the way. If you think you can't do it, we'll connect you with the person that can. Have you noticed any impact to your facility after getting the award? Just an influence on your culture or reputation. This award, it's been around, almost, we're getting into our third year now. So, and obviously Center of Excellence coming from AORN has a reputation that's becoming even global now. Have you noticed anything impactful to your facility's culture or reputation in your community?
I mean, I know our staff is very proud of the work they do every day. We know what we're doing is the safest approach to avoid incidents related to RSIs. We proudly display our award on the unit, so anybody coming through does see it. And Tracey did a fabulous job of putting together an event to help us celebrate our achievements.
Thank you. And one thing I would just like to say too is the extra step of knowing it's not just the general OR, that, along with labor and delivery and the cesarean sections, just kind of think out of the box and take it a step further, is really amazing, because they can happen everywhere.
Absolutely. Any surgical procedure, it can happen.
Yes.
So I cannot thank you all enough. Any parting words or advice that you can give to facilities before we wrap up our conversation?
Just go for it.
Yep. Just do it. And I want to say thank you to you, Hannah, and thank you to AORN for this opportunity. And thank you to Jill and her unit and at AHN Saint Vincent Hospital.
Oh my gosh. Well, thank you all. You all are stellar representatives of just what it looks like to be incredible caring nurses that do what's right. And also, y'all are a huge inspiration, I know, to other facilities who are considering this, that may be on the edge, nervous, or don't know if they can get the buy-in. I think y'all provided so many helpful tips and tricks to hospitals that want to implement RSI prevention practices, that know that it's the right thing to do, but maybe don't know where to start. So can't thank you enough, Jill and Tracey, for sharing your insights and experiences. As mentioned, your leadership and dedication to safety are inspiring. And I know that these conversations today are going to make an impact on the community that are hoping to get started. And a special thank you to Stryker for making the Center of Excellence RSI Prevention Award Program possible. Their support helps us empower perioperative teams everywhere to drive change, protect patients and staff alike. So thank you all for listening to this podcast, and we'll see you next time.
Thank you.
Thank you.
We hope you enjoyed this episode of Periop Talk. Be sure to like, comment, and subscribe so you never miss an update. And join the conversation with us on Instagram at AORNPics, or follow along on Facebook and LinkedIn. Looking for more perioperative resources? Visit aorn.org for everything you need, including clinical resources and educational tools. Thanks for listening.